We have a good number of folks already logged on, so I think we're going to get started. First of all, I want to welcome everyone. This is our sixth webinar on different subjects related to suicide prevention for the veteran population. And I wanted to give you a little overview of what we're going to be doing today. So our agenda for today will include first what I'm doing right now, giving an overview of the event. Then we'll be followed by the Department of Veteran Services Commissioner James Hendon, who will be giving some remarks. Then I'm going to give a brief overview of suicide prevention and social determinants of health, followed by Army veteran Sissy Brown, who's going to give personal testimony. Then John Mastalone from Community Health Action is going to be talking about his veterans program focused on social determinants of health. Then Dr. Nipa Kamdar will give a presentation on her research in this area of food insecurity and an overview of social determinants of health as suicide risk in the veteran population, and also talk about her involvement with the ETSSP program. Then we'll have Q&A and closing remarks. So that's the overview. I think at this point, I'm going to hand it over to Commissioner Hendon for his remarks and comments. So Commissioner Hendon, take it away.
Hey, Mike, thank you so much. Can you hear me?
Absolutely.
All right, thank you so much. As was mentioned, my name is James Hendon. I serve as commissioner for the New York City Department of Veteran Services. I first just want to give honors and salutations to the right people, starting with everyone who's here this morning. Thank you so much for taking time to be with us today for this discussion. And then to add on to it with specific people, I'd like to acknowledge Mike Matthews, just spoke, Director of Veterans Programs for Staten Island Performing Provider System. Army veteran Sissy Brown, who's going to give testimony this morning. John Mastalone, Community Health Action of Staten Island. Also Nipa Kamdar, PhD, a nurse scientist at the Houston VA, and instructor at the Baylor College of Medicine. And of course, from our own team at DVS, I want to call out Ellen Greeley, our Director of Grants Administration. And to all of whom I did not acknowledge, just know, once again, we thank you so much for taking this time to be with us. Welcome to today's Staten Island Veterans Suicide Prevention Collaborative meeting. Today's meeting is about social determinants of health, and they asked, me to provide an update as far as from the Department of Veteran Services. And I thought to just couch it in terms of the 5 determinants of health as identified by the U.S. Department of Health and Human Services. And so you'll get it later, but the pillars that I'm going to speak to as far as teasing out one thing that we do that touches each pillar, economic stability, education access and quality, healthcare access and quality, neighborhood care access and quality, neighborhood and built environment, and social and community context. And so I just tease out a little of what we're doing in each of these realms: economic stability, education access, healthcare access, neighborhood and built environment, and social and community. And so for economic stability, we've been helping veterans and their families take advantage of VA claims. You go to nyc.gov/vet claims to learn more. So anything from looking at remitting service-connected disability compensation, looking at obtaining dependent indemnity compensation if you are a dependent of a veteran who's passed and they had a condition that was recognized by the VA for you to receive compensation now, to a VA pension. So if you have a certain income bracket and a certain age beyond just Social Security, there's also VA pension available for our vets, and we help folks with that. That's nyc.gov/vet claims. When it comes to educational access, it's nyc.gov/vet students. We put everything under the sun on education there. 3 things I'll call out. Of course, helping our veterans tie into their GI Bill benefits, be it Montgomery GI Bill, be it now post 9/11 GI Bill. Also, New York State has a version of the GI Bill called the Veterans Tuition Award Program. We're sure to tie our veterans into that. It's another version where the state will pay for a New York veteran who has an honorable discharge and who is a combat veteran, for them to have 8 semesters of undergrad paid for, 6 semesters of grad paid for, 6 semester equivalents of vocational school paid for at the SUNY rate. Wherever you go, it'll be at that SUNY rate, and that's the Veteran Tuition Award Program. Another one on education I have to speak to, especially for any of our people who are between jobs right now. There's a program the VA has right now called the Veteran Rapid Retraining Assistance Program, where VRAP will pay for you to obtain vocational training for up to 12 months and provide you with a housing allowance while you're doing it. If you're a veteran who's unemployed and who is exhausted or transferred all of her or his benefits. And more about all of this, once again, it's nyc.gov/vet students for that one. For healthcare access, you know, a lot of what we're doing is, I won't touch the mental health pieces today in detail because a lot of that's being covered through the great work Mike and the team and all of you are doing. nyc.gov/vet help has the whole rainbow. I will call out, we're working to help our veterans enlist in VA healthcare. Many of our veterans actually don't use the healthcare even though they're eligible. And so we do what we can to connect veterans with our local partners on the ground here with the Harbor Healthcare System in the Bronx, VA, depending on where they're located, to get them healthcare access. And once again, that's nyc.gov/vet health when it comes to that piece of healthcare. For neighborhood and built environment, we work to get our veterans access to housing, to quality housing. Wherever you are in your housing journey, we tell you, we want you to take a step up. So if you are someone who's couch surfing or in the shelter system, we have folks who work with you. If you're someone who is looking for affordable housing or in one spot looking for another, we have a team that can work with you there. If you're looking at taking advantage of the VA home loan program, exact same thing. And so that's nyc.gov/vet housing if you want to learn more about the housing aspect of what we do. As far as the social and community context, there's so much to say here. I want to focus on the volunteer aspect, where it's nyc.gov/vet volunteer, where members of our community can learn about ways to tie in with the larger ecosystem. We have great programs like Mission Vet Check. We do buddy check wellness calls for other members of the veteran community. We have our Veteran Voices Project, where we record the oral histories of our veterans, and we give that information to the Municipal Archives Library of Congress. If you want to be a recorder, we can work with you there. We have an ETS sponsorship program, where for veterans who are coming home to New York, we pair them with mentors who help them with their journey as they're transitioning home. And then, of course, we have a lot of work we do around food, specifically packing meals every Wednesday morning in partnership with HelloFresh and the Campaign Against Hunger, a couple other good groups. And it's nyc.gov/vet volunteer to learn more. If you need food or know someone who needs it, tell them to go to nyc.gov/vet food if there's anything specific to food. You know, so that's the update. I tell you, I had it on my heart this morning just to say a few other things, if you'll indulge me. You know, what keeps me up at night in this job, a lot of things keep me up. One of the key ones is this issue of self-ID. You know, when you run the numbers, the VA has a report it puts out called the Gross Domestic Expenditure Report. It talks about how many people use VA services in every county, in every state, every year. And when I look at the New York numbers, about 24.1% of all veterans has at any time utilized VA services any way, shape, or form. That's about 1 out of every 4. And so what we deal with, and I know Ellen can attest to it, some others maybe here can attest to it, we have several veterans who not only are they not taking advantage of whatever benefits are out there, but you have veterans who don't even tell people that they've served. We've encountered student groups where they have so many students who are veterans, only a handful are active and saying, hey, I've served. You encounter employee groups where there is a veteran employee group where there are only so many who are active and there's so many more veterans in that workplace. People don't even know that person was in the Marine Corps, in the Coast Guard, the Navy, the Army, the Air Force. We have families who come to us sometimes who say, hey, you know, my father never talked about his service, but I'd like to see what's available to help him or to help her for my grandmother or my mother. And so it's trying to get more of our veterans to speak up and say, I'm in this tribe. There are people, I believe, in this webinar who may think, how can I be culturally competent? How can I best deal with the service members? How can I speak their lingo, communicate their language? And I recognize how that's important, but I can tell you what's 10 times more important is just having empathy and simply leading with your heart and how you deal with our people. And know that in my mind, the most important strategic value add once we get, you know, working with you is to ask the question, have you or have anyone in your family served in the military? I feel like, you know, we can't even talk about helping the veterans until we know who they are. And just tell yourself that for every veteran you see, there are another 2 to 3 people who are not even identifying, not even stepping up and saying, hey, I'm a part of this community. And so I ask you to, in addition to the things you do with all of your technical expertise in the mental health space, to just think over and over again. Let me keep asking this question to folks. Let's see if I can get some more of these people to come out into the light And I feel like that's an extremely powerful value add. And then we talk about everything else. But I think step one is to constantly ask the question. I guarantee many people here probably interact with a veteran every day, not even knowing that she is a veteran or that he is a veteran. Another thing I wanted to mention, we can't sit here and have this call today. It's January 13th, 2022, right? 10:13 a.m. We can't ignore the backdrop of what is going on. When I say we can't ignore the backdrop, the count right now for New York City, we have had 2 million cases confirmed and probable of COVID-19 since this pandemic began. It's 2,003,336. So 2,000,003 and then 336, cases of COVID-19. We have 145,316 total hospitalizations. It's 145,316. We've had 36,224 confirmed and probable deaths. So it's 36,224. That's since the pandemic began. This Omicron surge has us in a spot where about 30% of all who are tested in the city are testing positive. It's not even including people who take the test at home. And that's the COVID piece of it. We look at the unemployment piece, where we've been on a roller coaster as a country with unemployment, where it was up and then down for America to 4.2%. But New York City has held constant at about 9.4% unemployment. In other words, we still haven't really bounced back as a city. We're working on it. We haven't. Go to nyc.gov/vetjobs if you need help on that side. We look at this unemployment piece, and then let's add to it the consumer price index. Anyone who went to the grocery store recently, you've seen these prices go up. Inflation up 7% last year, the fastest pace since '82. Goodness gracious, gas costs $1.24 more from a year ago. Milk, a gallon of milk is 20 cents higher than it was a year ago. Eggs, a carton is about 31 cents greater than it was a year ago. A pound of ground beef, 59 cents greater than it was a year ago. And this doesn't just affect the people you're serving as mental health practitioners. This affects every single one of you. And then, I almost forgot, I have a 4-year-old. I got a call today where they may go remote for my 4-year-old's UPK. And so for those who are parents, what you're dealing with, this affects every single one of you. And I would be wrong if I didn't say that we don't speak to that, or we don't see that. And so we talk about social determinants of health. You need to have your house in order as you're helping other people. And please know that we're here, that we see you, and that we're here to help. The mission of this agency is to connect, mobilize, and empower New York City's veteran community in order to foster purpose-driven lives for service members, past and present, and their families, caregivers, survivors. You all are members of the community too. So regardless of whether you served or not, if you're in this group, if you are part of these efforts, you're in our tribe, reach out to us. We're happy to help you in any way that we can. If it's something that ties to your veteran identity, great. If it's something that doesn't, this is a city agency. Whatever we can do to be right by you and issues that may impact you, you're in our community. We're charged to assist you, and we recognize these are tough times we're going through right now. We'll get it out again and again for you, but the phone number for DVS is 212-416-5250. It's 212-416-5250. The email address is connect@veterans.nyc.gov. It's connect@veterans.nyc.gov. The website is nyc.gov/vets. It's nyc.gov/vets. And on social media, the handle, it's @NYC Veterans. It's @NYC Veterans. And so, you got to put the gas mask on yourself before you can put it on other folks. And we recognize that here. And so to conclude this, ask the question: have you or a member of your family served? I feel like that's step one. So whenever you're doing things in your day-to-day, even, regardless of whether it's a trigger saying this may be a veteran or not, just ask the question, have you or anyone in your family served? Another one is tell people about what we offer as far as, us at DVS and other people trying to help folks in this tribe. Tell people about what we offer and use this as an arrow in your quiver. By the way, tell yourself too, we're here to help everybody, including you. And then, to those who serve and to those who serve the folks who served, thank you. Can't say it enough. Thank you all. I saw these quotes. I want to say these it was on my heart to say these. I want to just wrap it like this and I'll pass it back to you, Mike. One is a quote from Ralph Waldo Emerson. It goes, "The purpose of life is not to be happy. It is to be useful, to be honorable, to be compassionate, to have it make some difference that you have lived and lived well." So the purpose of life is not to be happy. It is to be useful, to be honorable, to be compassionate, to have it make some difference that you have lived and lived well. And then the other quote Got to go old school back to Cicero. Non nobis solum nati sumus. It's non nobis solum nati sumus. This is Marcus Tullius Cicero. Not for ourselves alone are we born. So it's not for ourselves alone are we born. We appreciate everything y'all are doing. God bless you. God bless the city of New York, and God bless America. Back to you, Mike.
Commissioner Hendon, thank you so much. As usual, you are articulate, inspiring, and just comprehensive. So thank you so much. And I have to also give a shout out, to the commissioner, and also specifically to Ellen Greeley, who have been incredible partners in all our efforts here on Staten Island. And I can't thank you and Ellen more in that regard. By the way, in terms of asking, we're going to come back when one of our presentations on chassis, we'll be addressing that issue, but we'll wait to get to that point, later. But at this point, I just wanted to mention that this session is being recorded, and we will make it available as a YouTube video after the session. If you have any questions, put them in the chat. We'll try to answer them. And if there are any contact information that you want to have shared, put that in the chat too. After the session, we will collect those and send them out. So we want to really encourage, this meeting to be one where we exchange information, we exchange resources, and we learn from each other. So at this point, what I'm going to do is I'm going to shift to Sissy Brown, who is who's going to be giving personal testimony in terms of her own experiences in terms of the issues that we're talking about today. So Sissy, I'm pretty sure I saw you there before. If you are, please jump in.
Hello, good morning, everyone. Can you hear me?
Yes, we can.
Hi, my given name is Narcissus Brown. I am a U.S. Army combat veteran. I have 3 children, 2 adult males, 1 who is currently serving, and 1 who served from the age of 17 to 23. And then my boss, who's 8 years old. So I have 3 boys. Before going into the military, I worked in numerous homeless shelters, SROs, family shelters, children shelters. And I didn't quite understand, as we all see when we walk the streets of New York City, why there are so many homeless veterans. I didn't understand. When I returned home in 2006, I understood. I was a homeless veteran with a family. And I didn't know what to do. I didn't know where to go, who to ask. Thank goodness that's not the case now. We hope with the rent moratorium ending the 15th, 2 days from now. It's going to be scary for a lot of people. So please, just reach out to these people, veteran, non-veteran, we're all human. I have a master's degree. I don't display that. I don't display my veteran status. I used to, when I would apply, when I'd be at work and, and speak, but I had to stop because I had to learn that it's an intimidation tool for a lot of people for many different reasons. When the pandemic hit, we were all devastated. No savings, didn't know what to do, no food. And I had just started a city job and now I'm unemployed. Before the pandemic, I seen community health action and the Rotary Club out in my neighborhood, and they were awesome, not where they are awesome. They're beautiful. So I just decided, to walk by and ask a couple of questions. And the person took down my name and my number. This is way before the pandemic. And when the pandemic hit, I got a call from John. I said, who's John? And we spoke on the phone for hours. I think he was the last person in the office, and he wouldn't let me go. I didn't understand then. I understand now. We know that there's if you don't know, we do know that there's a daily list of 22, at least 22 veterans, at least. It's way more of different ages, different walks of life, religions, and for different reasons. They commit suicide. We don't know why they do that. We can only assume a guess. I was gonna be on that list, if not for John and a Rotary Club. I reside on Staten Island. I was gonna take my car. Well, it doesn't belong to me because I'm back on payments. And my 8-year-old drive to the middle of the Verrazano Bridge and jump. That's when I realized why Mr. John stayed on the phone with me so long. We talked about who knows what. And the last thing he said to me is, we will not forget you. You don't forget you. I wake up every morning and say happy birthday because I didn't get to the after party yet. And I repeat those same words. We will not forget you. You don't forget you. Thus keeping me off the daily 22 list. There's another acronym, RED. Remember everyone deployed. Some of them will come home. Some of them will not come home, and a lot of them will never come home mentally. Before the pandemic, income, food insecurities, income, education are big reasons why people, not only just veterans, people decide to leave, commit suicide, take themselves, take others. But now it's even more strenuous that we stick together, no matter our status or how our social pops up with a V or no V for veteran status. As humans, you can stop someone from committing homicide or even suicide just by listening, not judging, not being combative or argumentative. Most of the time, you won't even agree with what the person is saying. You might not even care, but just remember that someone home needs that person and loves that person and needs that person to come home. So if you're lucky enough and fortunate enough to be that person face to face or on the other end to listen, you just saved more than one life. You just saved, who knows, a mass shooting. One suicide to me equates to a mass death, because it ripples and affects so many people that person didn't even get to meet yet, people that person didn't get to touch. And Mr. John and Mr. Mike stop that ripple for me. I'm here. My family is happy that I'm here. People I didn't meet yet are probably happy that I'm here. It's a struggle day to day with not actually doing it, but it's became a lot easier when there's avenues and there's people. People are the avenue. People make these programs. And a lot of veterans don't really care to interact with civilians because they don't understand, or they'll never know, or it's many reasons that they choose not to speak to civilians. I'm glad that I stopped by, what was it, 2018? Who knows? I'm glad that I stopped by the Community Action and Notary Club truck. And they stopped me, they saved me. I didn't realize that I needed to be saved, but they did. Every week, I have a meal to prepare for me and my 8-year-old every week, for the whole week. I'm not able to pay rent. I'm not able to pay bills. I don't worry about that. I need to, but it's nothing I can do. They want to come and get the car, they can come and get the car. They want to evict us, they can come and evict us. But we are here, we are alive. As long as we are alive and not cold to each other, it'll be okay. Sometimes it's okay not to be okay. The suicide comes into, when is this gonna end? When will I be able to provide? When will I get a job? When will I stop being fired because people feel intimidated by me? So a lot of us do not disclose that we are veterans. Yeah, maybe HR will know because there's programs and there's incentives for them, you know, for hiring certain groups, whether it be women, minorities, youth, veteran, ADA, people with disabilities. Yes, it's all money, it's all numbers. But we're all people, regardless of our income, our political view, our religion. We're all people, and we need each other. We need those that serve. We need those that don't serve. We need people back here to make sure that we're okay wherever we serve. So yes, I say thank you for those who have served, will serve, and continue to serve, whether it's in the military or in the civilian world. Just remember, by listening and knowing the signs, you can save everybody. You can save everybody. Saving one is saving all. I'm crying now, and I have my coat on because I have to go. I had a returning home, a death in the family. But I'm gonna stay. I'm gonna listen. I'm gonna learn. If you have any questions, feel free. My cell phone number is 646-687-3560. Please forgive me if I do not remember. That's one of the bad side effects of my medication or just being a human, where the body protects itself not to remember because it's hurtful to that person and others around them who do not understand why we're flashing or why a smell will have us agitated, irritated, why we can't get into elevators, why we can't be in a group, why we choose not to speak, why people think that we're just being difficult. It's not that. We're trying to protect ourselves and others, meaning veterans. I can get good jobs. I just can't seem to keep them. One is, once people know I'm a veteran, Again, they feel intimidated. I don't even put on my resume that I have a master's or anything. I put that I have a high school diploma just so I could be able to feed my family. And I never make it a year. It's been going on since '06. So if you can just picture trying to provide for your family, and you know there's a cutoff, you know you're not going to make it through probation,
Let's see.
and you know that.
Hey, Keith.
Hello?
Hey, man. Just
I don't know what happened. I hear somebody talking. I'm sorry. I don't mean to bore you, but just imagine if you knew this was a recurring thing, how scary it would be, how you would feel like, you know what? I can't leave this baby here by himself. I'm gonna just commit homicide and suicide. Just imagine that. That's what I go through every time I apply for a job. And I try to save as much as I can because I know the end is coming. I know it. I try to do everything I can not to have that end come as far as my employment. It never fails. From '06 to 2022, it happens. I am unemployed once again. Or I have to take mediocre jobs, which is fine. It doesn't bother me. You want me to sweep the floor? You pay me, I sweep the floor. You want me to clean the windows, pick up the trash, drive the bus, click buttons? I'm here. But I always hear. I'm always here. I always hear, oh, you're not going to take my job. And I'm like, this is not your job. It's a thing. I'm a person. I'm not here to take your job. I just want to make my little pennies in peace and go home. You don't have to be a veteran here to have heard that. So when people, which probably will never happen, when people start being humane and strong and have self-confidence in themselves, no one can take it. You're there. You do what you're supposed to do. It's your job. But I never get to keep mine because of that. I haven't learned how to keep a job. I do my job well. But not having a job has me looking at that daily 22 list every day. And I know it would hurt my family. It would hurt Mike. It would hurt Mr. John. It would hurt a lot of people if my name came up on that list. So I try every day to have a birthday, not to go to the after party. It's hard. It's hard. Again, thank you. Thank you for all you do. Thank you for listening. Just remember, there's somebody, it could be you, that's going through something. And of course, we don't want to go to, the company's program, their shrink, their this, their that. Even if you talk to a tree just to get it out, you could talk to the mirror, talk to the cabinet. Who cares when you talk? Just talk. Just get it out. Mr. Mike and Mr. John taught me that, to get it out. Because if you don't, you can hurt yourself or others. I can babble on and on, but thank you. Thank you so much. Thank you for all you do. Thank you for listening. Thank you for learning. Thank you for not forgetting about us out here in the forgotten borough of Staten Island. Uh, again, my number is 646-687-3560. Thank you so much. I love you, Mr. Mike. I love you, Mr. John, and everyone here. I love you. Thank you so much. Take care and be well.
Sissy, thank you so much for your bravery, for your honesty. It's just what you just shared is just so moving, and I know John told me that you literally are in Virginia because of a death in the family, and all the more reason why I appreciate your coming on and giving your testimony and speaking so powerfully about the issues of veteran suicide and social determinants of health. So kind of hard to know how to move on from that. But again, thank you so much, Sissy. I was going to be giving an overview with a slide of the importance of the issue of suicide in veterans and social determinants of health. I almost feel like I don't have to, because Sissy hit all the points, but just briefly, let me say a couple of things to put, this meeting today in context, and that is, the suicide rate for the general population has been increasing incredibly, in the last 20 years. For veterans, it's 1.5 times that of the general population. For our post 9/11 veterans, it's more than doubled since 2006. At least 4 to 5 times as many service members and veterans have died by suicide than died in combat. And that we know that the transition in that first year for our post 9/11 veterans is the period of most vulnerability. And that the 2020 annual report from the VA really indicated that we need to move beyond providing excellent mental health and substance use treatment and really get into the issue of a public health approach or a social determinants of health, all the issues that Sissy was bringing forth, so powerfully. I'm just to say one other thing before I turn it over to John, who's going to talk about the work that Chassis has been doing, and that is Chassis is a civilian organization, and it's very important for civilian organizations that are not veteran focused to get training in military culture, and Chassis has done that and has done it extremely well, and I'm sure John will include part of that in his presentation. So what I'm going to do right now is I'm going to turn it over to John. John, I want to get your slides up. Let's see. Wait. I had this worked out before, so hang on a second. I'm getting some technical help right now because I just want the PowerPoints, which I lost.
While Mike is looking for the slides, I need to recognize Frank Wilkerson from the North Shore Rotary, who has been very influential in his well checks with Sissy as well. And I've had many conversations with her, but so has Frank. And I would be remiss if I didn't recognize him helping us with the North Shore Rotary and their partnership with Chassis.
Okay, John.
Thank you, Mike. Community Health Action, a few years ago, was given a Veterans Project by the PPS, and our Executive Director, Diane Arnett, assigned that to me. And it's been a work that I have come to really, really enjoy, and the slides will tell a little bit more. Are you advancing them, Mike, or am I?
There you go.
Thank you. We have a number of programs that connect people to services that address immediate needs: domestic violence, food insecurity, HIV diagnosis, many more. Over time, we get to learn about each person and their needs, and we connect them with other resources to improve their health and access to care. The Veterans Project definitely fits right in. A little over 2 years ago, we started serving 25 Staten Island military households. We began with looking into our own database, and before we knew it, it quickly turned into a word of mouth thing where other vets were telling their friends who were also individuals who served in the military, and they started calling us as well. The Social Determinants of Health is a screening tool developed by the PPS to identify client needs and connect people to resources to help them solve the problems they're facing. The SDOH survey was very instrumental in bridging the gaps between the veterans that we had in our database and the crucial services that they need. The tool is very easy to use. It's client-centered. We uncover needs. We're able to find providers across the island that can help. Through the PPS and through our own contacts, we have partners that we trust and recommend for many, many years. Thank goodness that Chassis is large enough that, many times we can provide the service that the veteran needs within our own agency as well. I believe we skipped a slide. Okay, no, okay, go.
Did we?
Yeah, there's that one, okay. Veterans that we've served in the project have been connected to the Vet Center, RSVP, the American Legion. Commissioner Hendon and his staff have been very cooperative. We've spoken to them as well. The staff at Fort Wadsworth, the VA clinic on South Avenue, the Brooklyn VA, and the Staten Island Task Force to assist in ending veteran suicide. We deliver food, and it's so much more though. We do wellness checks when we deliver the food. We do wellness checks throughout the week, evenings, weekends, it doesn't matter. Right now, I worked pretty hard to help this 71-year-old veteran on Staten Island who also is having trouble with his rent. He was working in Manhattan, Brooklyn, all hours, all different shifts, successfully with the help of Workforce One. I was able to get him a job on Staten Island so that he doesn't have to be traveling all over the place anymore. And he's very happy about that. And right now we're still bad. That was only half the battle with him. Right now, the Unemployment Department of Labor owes him 16 weeks of back unemployment. And I have recruited assistance from Senator Diane Savino. We have done so much work with this individual who served in the military, and we're still fighting to get him those 16 weeks of back unemployment. It's frustrating. And he needs the money, and I'm not going to stop until I can, get that done for him. But he's only one case. Like I said, the wellness checks take place all the time. They have my cell phone. They call me anytime. I speak with them. They call us to tell it. They call Frank. They call me. They call Diane. They want to tell us about a pending. One had a hip replacement. Another had knee surgery. Another one is battling cancer. Sometimes they just want to call and talk, and we do that too. Frank from the Rotary does it. We all do it, and we do it with all our heart. I delivered food last week. I'm not trying to sound like I'm anybody special, because I'm not. And the particular veteran, I brought the food into him because he has a hard time carrying the bags, and he says to me, "John, can you please help me to put this pain patch on my back?" And of course, I helped him put the pain patch on his back, and you could see that he's not feeling well. And I sat and I talked to him for a little while, and then unfortunately I had to leave to make my other deliveries. But it's things like that that Chassis and the North Shore Rotary do all the time. And we do it with all our heart, and we wish we could do a lot more, believe me. But we try to give them food bi-weekly, but it's enough food that would carry them over for 2 weeks. We've distributed masks. I can't count how many masks I sent out. We don't send it to just the individual who served in the military. If their spouse, if they have children living with them, we give it to them as well. That's my director right there, Diana, under the right picture. We've connected many of them to services at the Bay Street Clinic for dental and PCP appointments, which has been, very enlightening. They didn't even know that the place existed, and we were able to connect them there as well. So that's a big thing, it's when we can help them get medical assistance. We've helped a few of them with housing. It just, whatever we can do, we do, and we're going to keep doing it. And the PPS has been wonderful with Chassis, and it's because of them that, we're in this project and that we can make a difference in the lives of the military individuals who reside on Staten Island. Sissy is a wonderful, wonderful woman. And now that I know that she's unemployed again, I'm going to do my best to help her get her resume revised, and we'll get her back employed as well. And it's been a very heartwarming project for me. I thank Mike and Joe Conti and my executive director, Diane, for allowing me to work with these special individuals. Thank you very much.
Thank you, John. John, could you please just make a little comment about the training in military culture?
Well, yes. A couple of things that I forgot, because Sissy was so powerful that I couldn't stop thinking about things that she said. Forgive me. I learned a lot about the military culture through my conversations with the individuals who served in the military in our database. And in the beginning, they're a little shy, and then they warm up to you. Once they see that you really care about them, the comfort level that I have developed with these 25 individuals is wonderful. And I must tell you about, we've provided Thanksgiving dinners to many of them who, without that, they wouldn't have had a Thanksgiving dinner. At Christmas time, we found the ages of the children and grandchildren that they live with, and we gifted each and every child with an age-appropriate gift. For the last 2 Christmases, we did that. last Veterans Day, we made special medals of honor, and we gave each one of them that along with a gift. This Veterans Day, we took them out to the Staten, a local catering facility, and we provided gifts and we honored them for serving our country. Many of them spoke at the event. Sissy was one of them. And like I said, it's a project that I hope that we can keep moving forward with the help of the PPS. And I hope the funding never ends so that we can, always keep up the good work with these individuals who need our help. And personally, I'll keep doing it until I'm told to stop.
John, thank you again, so much for your presentation and for the incredible work that you do and how Diane has supported this. I mean, I have to mention one little story, Diane, the executive director. There was one point when John couldn't deliver meals and Diane did. So talk about, dedication from the top on down. It's really just quite incredible.
I had a hip replacement last year and I was unable to do it for a while, and Diane and the Rotary took over.
Right. Yeah. Again, thank you so much, John, and thank you for all the the work that you're doing for our Staten Island veterans. So what I'd like to do now is shift focus to our Dr. Nipa Kamdar's presentation. And let me just say that the way I really thought about this presentation, we wanted to start from the personal, then talk about how a civilian organization can provide service. But there's also the element that's important, that we need to study this issue. And Nipa is a researcher who has actually done work in this area and is quite committed to it. So before I shift it over to Nipa, I'm just going to give you her bio. She is a health science specialist at the Michael E. DeBakey VA Medical Center in Houston, Texas. She seeks to understand how our environment influences our health and well-being. She's most interested in reducing upstream issues that contribute to food insecurity and other health inequities. Dr. Kamdar served various communities for more than a decade as a family nurse practitioner prior to earning her doctorate in nursing. Excuse me. As a Robert Wood Johnson Future of Nursing Scholar. Her interactions with hundreds of individuals and their families guide her research. Her experience providing healthcare in community settings also fosters her commitment, excuse me, to working with community partners to address complex issues like addressing social needs. So Nipa, thank you so much, for joining us. I'm gonna now share my screen for your slides, and hopefully this will work. Oh no, hang on a second. I have to stop sharing. Where?
I can share mine too. I've got them pulled up.
Yeah, you can get started. Okay, as I get my technical help.
Okay, I'm going to share my screen with y'all. Can you see my slides?
Okay.
Do you see them?
Yes. Oh, you're sharing. Okay.
Yeah, I'm sharing them.
Okay. So you're gonna drive.
Yeah, I'll drive.
Okay.
I'll take
Thank
it.
you.
I'm not going to put it in the fancy presenter mode, just because that gets complicated for me. So let's see here. Well, we've talked a lot about food. Well, actually, we've heard a lot about food insecurity today, and I wanted to, for those of you who are not familiar with the definition, just want to start with that. So it's the lack of access to food, usually due to not having enough money. And the USDA identifies 4 levels of severity with food insecurity. One of them is high food insecurity. That is basically somebody who's food secure. They have no problems accessing food, and they can go to the store and buy what they need and what they want whenever they want to. Marginal food security are those people who are able to purchase what they need, but they might have some anxiety or some worry about whether they're going to make it to the end of the month.
Nipa,
And then
Nipa, excuse me, it's a little bit hard to hear you, a little bit muted, so I'm not sure. I just wanted to give you a little feedback on that. I'm not sure.
let me see if I can fix that. Is this better?
Much better. Thank
Okay.
you.
Yeah, my headset mic was turned off. Sorry about that. Let me restart real quick here. I'm going to go to this top there. So that's my name, Nipa Kamdar. I am based in Houston, Texas, and I am a health science specialist here at the VA in Houston. He already read my bio. So back to food insecurity. Just a quick definition. It is the lack of access to food, usually due to not having enough money. There are 4 levels of severity that the USDA has defined for us. The first one is high food security. That's somebody who can go to the store and buy what they need whenever they want. No worries about having the funds to purchase the food. Marginal food security are those people who have a little bit of anxiety or a little bit of worry whether or not they're going to have enough money, but usually they're able to make it. And then low food security, those are people who are now like, okay, I may not have enough money at the end of the month, so let me kind of change what I'm buying at the store. And then we get into the very low food security. And those are the folks who are skipping meals, cutting back on what they're eating. They're buying food that they may not necessarily want to eat, but that's what they can afford to eat. So that's food insecurity overviewed. Now, food insecurity among veterans. So I looked at national data, and when I compared the prevalence of how often veterans are food insecure compared to the general US population, their prevalence rates are kind of similar. But when we start to drill down a little bit more to see, well, what kind of food insecurity are they experiencing? There we see a striking difference. Veterans are 3 times more likely to either skip a meal or cut down on what they're eating compared to their equivalent civilian, meaning somebody who's got the same gender, same education, same socioeconomic background as them. A veteran is much more likely to ration their food intake. And when I've asked other veterans, why is this so? They kind of look at me and say, we're rationing our food because that's what we're trained to do. When supplies are low, they go into a survival mode. So we know that in the general population, food insecurity is associated with stress and mental well-being, but nobody really examined how food insecurity was related to mental health in the veteran population. So once again, you know, our data is kind of restricted on food insecurity in the veteran population, but there was one data source that's really good. That's the National Health and Nutrition Examination Survey. And I looked at data from 2007 to 2016. And I was able to find 2,630 veterans in this data set that we could test some models on. What I was looking at specifically were food insecurity, and that was measured using the 18-item USDA Household Food Security Survey. That's considered the gold standard in measuring food insecurity in the United States at this time. And then in that data set, they also measured depression symptoms using the PHQ-9. And they also asked that 9th question. That's the question about suicidal ideation. So I was able to look at those 3 data points. I also accounted for gender, age, income to poverty ratio, race, ethnicity, and education level, because we know these are things that can also have a role with depression and other mental health issues. So just to give you like a real quick description of the sample, 11.5% of the veterans were food insecure. Their depression scores averaged 2.86 with a standard deviation of 4.2, and 3.7 endorsed suicidal ideation. And that 3.7 is kind of consistent with some of the other studies that I compared with how often would a sample that's not like specifically pointed towards suicide, how often would they endorse it? So some major findings: the symptoms of depression increased as food insecurity worsened, and that probably makes logical sense. For those of you who like statistics, I threw them in here, but I'm not going to read them verbatim. Another major finding was that veterans with low or very low food security, again, that's that one where they're skipping meals, they're cutting back on their intake, they were more likely to have thoughts of suicide. And I have heard this. I also do qualitative research. So I interview veterans who've been food insecure, and I've heard them talk about how they reach a point where they just want to give up because they don't have enough food, they're struggling to find a place to live, and they're just ready to give up. So this is consistent with what I've heard from the voices of veterans. Implications of this, veterans who food insecure really need to be screened for depression and suicidal ideation. Simultaneously, when we're treating veterans for depression and all these suicide prevention programs that are coming out, we really need to consider social needs like food insecurity as part of that packaging, and consider this veteran as a whole individual with multiple needs. I'm a very visual person, so for those of you out there who are also visual, this is an image that kind of captures everything that I just said. It's got the 4 levels of food security, and we've got this very low food security. This triangle on the top is very important because, again, veterans, when they're food insecure, are more likely to land in this box right here. And this box, or this triangle rather, is associated with depression and suicidal ideation. There are a couple of publications. If somebody is not able to access the full article, I'm going to share my email with you in just a little bit. You can email me and I'll send you the full article. So with all that, that's research, right? But that's not action. What are we doing? And one of the very exciting programs that's coming out with Dr. Garasi at the VA Bronx and now nationally across the VA is the Transitioning Service Member Veteran Sponsorship Program. And I think you've already heard a little bit about this, but again, to kind of drill it down, it's a VHA supported suicide program that has a lot of potential to reach those upstream factors that contribute to food insecurity, which is why I am very excited for this program. It's led by Dr. Joseph Garasi. He is a lieutenant colonel, retired infantry, and a licensed psychologist. I think I just skipped over a whole bunch. At the core of this program, transitioning service members get connected to a trained sponsor. They also get connected with community resources, including employment opportunities with our community partners and VA healthcare services. And all of these factors will help address those upstream factors that contribute to the lack of social needs. If you want to get involved, go to this website, click on Help Others, and you can sign up to become a sponsor. And that is my email address. So I'm done with my formal presentation.
Thank you so much. Nipa, really appreciate it. Kind of giving us the perspective from the research point of view and the interviews with large number of veterans, which kind of, and I think one of the things that does strike me, of course, is the fact that we started with Sissy's with her testimony, and you can see all the issues reflected on all the different levels of first the chassis work and on your work with research and with your interviewing. So I think I really appreciate the fact that you are doing this work, because it's clearly you're not, quotes, just a researcher. You're really you're really in the trenches as well, and talking with veterans and so on. So I think if I could just ask one other question, more general. I know that your work is primarily in the area of food insecurity, but I wonder if you could speak in general to the research or the lack thereof research in social determinants of health in general in the veteran population.
Yeah, I just think that there was a lack of awareness by most people doing research in veterans, looking beyond what's happening in the clinic setting. And that's changing. That's changing tremendously. The VA now has an entire funding source just for social determinants of health. But, there's a couple of, I don't want to call them out by name, but there's been a couple of really large studies on veterans. And when I looked through their data set to see, hey, can I find something on housing or food or those other social determinants of health, I can maybe find education on there, but I can't find, did they ask about food? Did they ask about housing? And so we're having to be creative in where can we find this data. Luckily, the CDC puts out these population surveillance surveys like the current population survey, the National Health and Nutrition Examination Survey. And in there, they asked a question to a participant, have you ever served in the US military? And from there, we can glean a veteran status, but it's not as straightforward as I wish it could be. So we're not starting from scratch, but we do have a lot of room for improvements.
Yeah, because that certainly was my impression. And, you know, as I made reference to earlier in the presentation, you know, the 2020 VA annual, you know, suicide report is really saying that to be more successful with suicide prevention, you really need to get into these areas. So I guess, you know, the combination of, you know, the research but then also the work with individuals and, you know, you know, might move us along in, you know, in the right direction. So, yeah. Could I ask one other question of you, Nipa? And that is that I'm wondering if you could explain a little bit about your personal experience and how you came to appreciate the importance of social factors, social determinants of health in your work.
Yeah, so that one started not really so much with the veteran population. As I stated before, I'm a nurse practitioner by training. So I worked from 2003 to about 2015 with a host of different populations in different settings. I started off in a very intense level 1 trauma hospital up in Detroit, taking care of extremely sick patients, watching them just deteriorate from end stage diabetes, end stage heart disease, end stage every illness you can imagine. And I thought, man, if we could just get to these people a little bit sooner, maybe their lives would be different. And they would leave the hospital and they would come right back around. It was like that revolving door concept. And I didn't understand it then, because although we took care of people who were homeless, it was never part of my discharge package other than making sure that they had a taxi cab voucher or they had a bus ticket to get to a bed at the shelter. I never thought beyond that about if they're going to have food, if they're going to have any other support once they leave this hospital. And sure enough, they didn't. They come back within 2 weeks worse than they were before. And then as I moved to Houston in 2012, I started working with children in low-income schools. And my clinic was based inside of their schools. I started eating lunch with them. I started hanging out with them at the playground and started talking to them. And I started to weave together this understanding of what's happening in their home and what's happening at their school has a direct impact on their health. And then when I went to get my doctorate, that's when I was introduced to the term social determinants. And then it clicked. I'm like, oh, of course, like how could I have worked for so many years providing healthcare? And I was a good nurse practitioner. Like I was good at my job. I cared about my people, but I never thought beyond that clinic wall or that hospital wall. I never thought beyond that. And I think that click on working with the kids, when I went to get my doctorate, I started looking at food insecurity there. And then I was able to snag a postdoc fellowship at the VA in Houston. And that's when my work started with veterans. And when I first came to our research lab at the VA here in Houston and talking about food insecurity, I got a lot of puzzling looks. People thought I was making this stuff up. And I've kind of demonstrated that this is real. It has true implications on people's health and well-being. And we got to start taking it seriously if we really want to help people.
Thank you. Actually, I see in the chat, there's a question from Ellen. She's asking if you could drill down on lack of money is a major reason for food insecurity. For veterans receiving VA disability income, Social Security, were they receiving SNAP?
Oh, the SNAP data is worse than the other data. SNAP's not allowed to ask veteran status. They would need an act of Congress, literally an act of Congress to ask that question. But we know from some other data, again, kind of getting creative, that there's fewer veterans on SNAP than those who are eligible for it. And when I've spoken to people about SNAP, when I've spoken to my veterans about SNAP, they apply, they just don't qualify because their disability income is counted as income. And so they fall out of that income qualifying bracket. Or if they qualify, they're getting like $15 a month. And that was, of course, pre-COVID. So those numbers probably tripled because of the changes to SNAP policy. But one thing I want to point out, when I'm talking about veterans and food insecurity, my personal definition of food insecurity is a bit broader. I want to look at food access. So when you have a veteran who is struggling to get food onto their table, you got to also consider their mental health. Some of them talk to me about how they can't walk into a grocery store to buy the food, even if they have the money, because it's an enclosed building. They need to know where the exits are. They need to have an exit strategy. Things that would never have crossed my mind, because I can walk into a grocery store, but I'm not worried about it blowing up. And they talk about how once they get the food to their car, they now have trouble walking through the grocery store, getting the food into the car, getting it into their car, and now they have to transport it into their home. Pain, their physical pain means that they're limited on how much they can actually do to prep the food. And we know that prepackaged, pre-prepared meals are less healthy and more expensive. So food access and food insecurity is a really complex topic. And we have to broaden how we approach making sure people have enough healthy food access, not just looking at food, but looking at the entire spectrum of the process of how that food goes from the market to their table. And I have a model for that in one of my publications, but that's how I look at food access, is the spectrum.
Thank you. I would like to open it up to questions that anyone has, but I just wanted to mention one other thing that came up in the chat, and that is Mindy Manarino, John, wants to connect with you because you know, she's aware of a veteran who might need some services. So I can connect you, or you can connect you know, after the fact. And by the way, I think this is one of the advantages of these kinds of meetings where, you know, folks can actually connect and provide, you know, kind of support or help for each other. But I did want to just kind of open it up to any general questions, if anyone has, of any of our, you know, to Sissy, to John, to Nipa, on all the different levels. So if anyone's interested, please unmute yourself and
let's see if I can get to this. Hello, my name is Eric Glaudet. I am a licensed clinical social worker. I worked for the VA for about 25 years. I just retired as a counselor at the Borough Manhattan Community College. So I'm kind of like looking for an area to work in. I do have some ideas. However, what I would like to point out to most of you is that what I am seeing, my observation is that my social work training tends to filter through and become effective in all other areas of practice. Especially, I see that Dr. Nipa, I'll call you your first name because I can't see you laugh, but she realized what she needed to do in terms of making an impact due to the social situation, like she said, social determinants. So we can be armchair psychologists or doctors or nurse practitioners, but if we do not get into really looking at what the social problems are, those old Axis 4 and Axis 5 things in the DSM-3, if you want to use that as a model. But I do see that it is a very important thing to get out of that chair and actually join if you want to really work with veterans and people in general. But I have a passion for working with veterans, and I give you kudos, Dr. Nipa, for what you did and what you are doing.
Thank you.
social work school only is about 1.5 to 2 years for all people who are working in this area. So it can be done. It's good training. Bye-bye.
I really think that there needs to be some cross training between providers and social work, because really we can't provide healthcare adequately if we can't address those other needs. But nurses are notoriously known for not staying in our lane, and I didn't stay in my lane.
So anyone else out there who has a question, a comment?
Yeah, I do. Hi, it's Ellen. How are you doing, everybody? Nipa, I put something in the chat. Can you drill down a little bit about the lack of money as a major reason for food insecurity? Are veterans receiving in your research? Did you look at the income issue, ask where their sources of income were? Are they receiving VA disability income? Are they receiving Social Security pensions? Are they also receiving SNAP benefits? I don't know if your research led to that direction.
So with the NHANES data, they did ask about SNAP, but when it had so much missing data in it, like so many people hadn't responded, I couldn't really use that. But so there's, and I can send you the report from another group. They looked at how many veterans are using SNAP. And what they concluded was that it's not enough. So as many veterans who could apply for SNAP are not, but SNAP applications themselves don't ask whether or not you're a veteran when you're completing that application. So there's not really a way to say, the number of people who apply for SNAP who are veterans and how many of them qualify and how many of them don't qualify. But a lot of the veterans who I've spoken with in my qualitative research, they talk about how they've applied for SNAP and multiple times, but they get rejected because their income with the disability that they're getting, or child support or other sources of income, puts them $1 or $2 or $5 over the limit.
Yeah, that's actually important to capture. The other groups also that I believe also have challenges within food insecurity are also the National Guard and reservists. We've been involved in a fairly robust HelloFresh program here in New York. We're lucky enough to receive about 2,000 food kits a week from our friends at HelloFresh, and we've been distributing it to about 1,000 veterans as well as military people on Wednesdays. My colleague, Susan Zimmett, I believe, is also on the phone from the state. What we're also kind of discovering, and I don't know whether this was revealed at all, was one is, New York City is filled with food deserts, and it's the accessibility to affordable and fresh fruits and vegetables is always a challenge here in New York City. Also, additionally, is just the time and preparation for the food. We have a group of veterans that we work with that are correctional officers who clearly from an income standpoint are maybe okay, but because of double and triple shifts, specifically because of COVID, they don't have time to shop or to prepare, which seems to have been another issue. And I was just wondering whether any of your research kind of led to kind of other reasons that may not necessarily be income oriented.
Yeah, I'm gonna see if I can quickly pull up a picture, but I did a publication looking at the whole process of food access, and let me just see how fast I can find it. See if I can work under pressure.
That's okay.
But
yeah. Go ahead.
But there are when we look at getting food to the table, we do need to look at personal capacity. So a person's individual capacity to do that includes mental health capacity and physical capacity. Right. And then we have to look at their resources. So do they have a kitchen? Do they have equipment in their kitchen? Right. A lot of veterans talked about when they transitioned, their stuff that they might have put those green stickers on to get moved with them. got lost somewhere. So they have to go to Goodwill or Walmart and just start their kitchen equipment from the scratch up. So material to make food and a place to make it. And then I forgot what my third column was. I want to say military culture, but we have to consider all three of these factors when we're trying to help veterans.
Right. Yeah, it's a lot more complicated than than it appears, to be honest with you, with just giving a bag of food. There's really more complexity involved in it too. That's what we've experienced also in many cases. But also, not just, to also think about National Guard and reservists when we're looking at, the whole picture in terms of food insecurity among military people.
Yeah, and I did find my pictures. I'm going to just share my screen with y'all. I'm going to pull it over. And I can share this with anybody who wants it. But this is when I think about food access, I look at type, quality, and quantity, and you got to look at the cultural influence, personal capacity, and their resources. So money is just one of the resource, time, transportation, all these factors. And I don't feel like we consider all of this. We recognize it, but we can't necessarily fix it all.
Right. That's right. Yeah. But also part of it is tailoring the food distribution piece in other ways also, I think, to address it. When do you just give, a bag of food, or when do you give prepared meals, for instance, is another factor in kind of looking at what, in terms of meeting the needs of the entire population.
Correct.
Great. Thank you so very much.
Thank you.
I had something I wanted to say. When we come home or leave the military, whether it was theater or non-theater, lay people seem to get this misconception or get it twisted or screwed that because you're a veteran, the government takes, and that's not necessarily true. To me, my biggest fight that I'm fighting still is with the government, with the benefits, the lack that I cannot get SNAP. I cannot get certain services because I'm a veteran. And like I said, when we first come home, we don't know. We don't know. And when we come into the population, again, people believe that, oh, you're a veteran, the government takes care of you. And that's not the case. Once we're out of service, we're no more good to them, which is sad. And that's basically how we're treated. I'm at 80% living in New York City. That's peanuts.
Yeah.
But it does stop me from receiving anything else. So at times I'd be like, wow, maybe I shouldn't have went into the military, because we can't predict what's gonna happen tomorrow or 20 years from now. Nobody's seen Corona coming. Nobody's seen that. But when we come home, maybe we need a little bit more. When we're out processing, we need a little bit more on actually transitioning. Listen, do you have a place to live when you come out? Where are you going? What are you going to do? As opposed to, thank you for your services, your DD-214. Good luck out there.
And that's the ETS program, Ms. Brown. That's one of the programs that's trying to do exactly what you're talking about, where a transitioning service member can get connected with a sponsor in their hometown. And when they're coming out, you've got somebody there to be like, hey, show me your resume. Let's get your resume together. This is a good neighborhood. These are good schools for your kids. Somebody, a friend, or a sponsor or coach, whatever you want to call them, we call them sponsors. But I'm hoping that program, as it takes hold, can address things so that well, it's too late for you, but others who are coming out don't experience it as you did.
Absolutely.
Yeah, I just wanted to say, because we're going to need to wrap up. I know, respectful of everyone's time, we're almost finished. But actually, the PPS, we are what's called a community integration coordinator for the ETS program, and we're very involved here on Staten Island. So there's a lot going on, and I'll be happy, to follow up with anyone who might want to learn a little bit more what's happening here on Staten Island. But given the fact that, we only have a few more minutes, I just wanted to kind of wrap up, and I wanted to thank so much, Sissy and John and Nipa for your excellent presentations today. And I think we really got a very good overview from the sort of the high level research aspect, the more of the personal of the importance of these, the social determinants of health, particularly, the food insecurity. I just want to repeat the fact that this session was recorded. We'll be sending it out for viewing to those, whoever was registered for the meeting, and any information or contacts in the chat will also capture and send that out. I also want to thank some people here at the PPS who got behind the scenes, who made everything work in terms of planning and scheduling, and that would be Adina Kolovic, Lauren Tepfer and Judy Patel. So thanks to them. And again, I would just thank everyone who participated today. These webinars are on a quarterly basis, so we'll be having another one in about 3 months. If anyone has any thoughts about which topic, we're actively considering that. And I also, again, want to reiterate the tremendous support that we've received from Ellen and Commissioner Hendon in terms of all of our work here at the Staten Island PPS in terms of the veteran suicide prevention. So I think that's where we'll leave it right now. So again, thank you for participating, and there will be follow-up.
Thank you.
Thank you.
Thank you.
Thanks, everyone.
Thank you, everyone. Have a good day.
Thanks. Take care. Have a great week.
All right, take care, y'all.
Take care, everybody.
See if I can get out of this. Turn this thing on. Oh, here we go.
Thank you, Mike.
Thank you so much, Nipa. And I guess we can also then at some point follow up with the whole issue of potentially looking at our SDOH data, but
Yes.
we'll
Yes.
have conversations about that.
Let me get 2 papers off my desk and then I'll come to that.
No problem at all. No rush when we get to it.
Yeah.
Take care.